With the FDA approval of a form of ketamine for the treatment of major depressive disorder, marked interest has arisen in potential other uses for ketamine. Dakwar and colleagues report new findings that combine ketamine with an important form of psychotherapy in the treatment of alcohol use disorders. The study uses a form of psychotherapy called motivational enhancement therapy, and it shows that the addition of ketamine to this psychotherapy has a greater effect on the clinical outcome associated with this psychotherapy as compared to adding placebo to this same form of treatment. And these findings are important for a few reasons. For one, they suggest that beyond mood disorders, where there's been tremendous research on ketamine and other compounds that act on the glutamate system, there is relevance for other disorders, in this instance, substance use disorders. Number two, the findings are important because they suggest that there might be unique clinical uses for new medications like ketamine, not only as standalone treatments, but also as adjuvants, as was done in this study, that are added to psychotherapies. The EMBARK study is a particularly important investigation on the treatment and neurobiology of major depressive disorder. Shinfat and colleagues report important new findings that look at baseline brain imaging measures as they relate to treatment outcome in the diagnosis of major depressive disorder. And a few key findings emerge from the study. One is to suggest that patterns of resting state functional connectivity might differentiate patients who are uniquely sensitive to the beneficial effects of sertraline. Another finding that relates to the first is that this pattern of predictive relationships emerges in a part of the brain called the default mode network, where there is already tremendous interest suggesting a perturbation in major depressive disorder. So the unique aspect of the finding is to suggest that one day it might be possible to use certain kinds of magnetic resonance imaging scans, such as resting state functional MRI scans, as was done in this study, and use them in a way that could potentially tailor particular treatments to particular patients.